So I'm just going to quickly argue, this is a familiar argument, but it's a really important one, that actually possibly nothing more complex than the effective sharing of data, transparency, knowledge could be possibly the fastest, most effective thing we have to deal with this challenge of efficiency, not just in healthcare, but in public services in general. And I was trying to think of a way of kind of putting this in context. And so I'm just going to tell you a quick story about an amazing sort of social phenomenon that's taking place in Uttar Pradesh, which is a province of India, in which the local authorities decided that they had to move the needle on endemic corruption in their welfare system. And they were at a loss as to how to do this. And they decided that in the end, that the only way they could really do this was to kind of crowdsource their data. So what they wanted to do was publish data on the individual claimants of the welfare system, and they wanted local villagers to be able to authenticate, to validate whether or not these people were real, because they were noticing enormous amounts of just fraudulent claims being made. And so in this particular part of India, the mobile phone, of course, is ubiquitous, but the internet is not. It's very difficult to get broadband access. And they really wanted people to look at spreadsheets. It was all about data, and mobile phones are no good for spreadsheets. So what in the end they did was to paint spreadsheets on the walls of buildings in villages around Uttar Pradesh. There are now 100,000 walls in India which are hotly contested by different parts of the public service, with people, literally whole armies of people rushing around with whitewash, painting in on the spreadsheet details of the person, the claim, and then everyone is kind of crowdsourcing that. You know, villagers passing by and they are daubing on those names whether or not that person really exists in their village. The net result has been a 25% decrease in the expenditure on the welfare system in Uttar Pradesh. And I just say that because transparency is not about technology. Transparency is just about data. And my view, and this is why I'm doing my current job, is that data is going to be the one principal contribution that this generation makes to public service reform in general. So transparency is really not easy for governments. It takes your monopoly over spin right out of your hands. And every time we release an important data set, we've just done criminal justice, you know, the very first response, quite rightly, is the observation that things are not going that well, that there's variation in delivery. So it needs real political courage, and I must just pay tribute to the fact that that exists and it is enabling me and my team to start doing, I think, some important things. So healthcare is our beacon in relation to transparency, and I'm sure people here will know that, for example, we're now committed to really important things like every citizen having the right of online access to their medical record from 2014. That was announced in the Growth Review, the Autumn Statement last November. And similarly, we are now going to have a joined-up data set available to the life sciences sector and to everybody else, commissions in the NHS, which links secondary and primary care data for the very first time at anonymised patient-level data from September. And I personally believe that these will be transformative events, not just in terms of accountability in healthcare, but also in driving productivity in our system. Now, the evidence for the relationship between data and important things like saving lives in hospitals is really good now. And my sort of central task is just to sell that narrative to people. I mean, we're all familiar with the Bruce Keogh story, and it really is true that when the heart surgeons in this country decided to publish data on their outcomes, actually mortality rates fell by up to a third. You know, that really is true. And they attribute that, not me, they attribute that, Bruce does, specifically to this simple thing of publishing data and comparing performance, leading to a kind of honourable competition between those professionals in delivery of the service. What is now going to happen is we're now engaging in a new, broader commitment to open government. So I feel that although open data, we're far from having finished the job there. I think people now are beginning to recognise, and particularly it's true in healthcare, that better data equals more intelligence, better knowledge. Open government is basically transparency, which is government being a source of information to citizens, and participation, which is the thing we haven't done, which is citizens being a source of information for government. Now, if we can do those two things, honestly, I think we'll find ourselves with much smaller, much more effective government and public service delivery. And that's all about customer insight. And then we move towards Open Britain, which, again, will be sort of articulated more over the coming months, which is the idea that actually government on its own can't solve this problem of knowledge in our society. We are a very knowledge-poor, information-rich society. And that involves business, it involves other non-governmental bodies taking transparency seriously, sharing their data. You know, ultimately, patients in the NHS are going to be much better served when they can mash their medical record with their Tesco Clubcard data on their own terms and figure out whether they're consuming too much salt or not. Now, they can't do that because Tesco has no observable business model for sharing their data with anybody at all. And we have to help Tesco and other large brands figure out why there's benefit to them in data sharing, and that's the next phase. And then finally, just kind of wrap up, we have this sounds idiotic, sort of concept really of open world, which is the idea that actually if we share our problems and we share data about our problems, we are more likely to solve them more efficiently. And that's not just about us in the health service, it's not just about us being part of the public sector, it's not even just about us being in the UK, but it's us learning from amazing projects in Mongolia and Liberia, for example, where they've really solved corruption through nothing more complex than publishing public contracts.